What's going on, everyone? It's Alex here from Aleks Physio. So today we're going to be chatting about whether to use ice or heat after you've sustained a musculoskeletal soft tissue injury. Before we do that, I need you to hit the like button and subscribe for future videos. It really allows my channel to grow and it allows me to reach a wider audience. I have over 350 long and short form videos related to the physiotherapy profession, such as injury prevention, exercise prescription, things that you may or may not have known about physio, with the hopes of trying to educate you on what we can do as physiotherapists to help you achieve your fitness and wellness related goals. So let's get into it. Back in 1978, the RICE protocol was designed following a soft tissue injury, and it stated R is for rest, I ice, C compression, and E elevation. And there have been changes with regards to the RICE acronym as an injury recovery guideline from that time. From RICE, it went to PRICE, which is now P stands for protect. So using walker, crutches, gait aids, a sling for upper body injuries, trying to protect that region from further insult or injury and allowing the appropriate healing to take place. Then from price, we went to police. So the P is still protect, and then the OL we have optimal loading. So now we're looking into incorporating exercises and appropriate loading for the tissue to allow the healing to facilitate and continue onwards versus the rest that had initially been prescribed early on. And then in 2019, we went to peace and love. So notice that in peace and love, there's no I in there, there's no ice. So P, protect, E, elevate, A, avoid anti-inflammatories, C, compression, E, educate, and then love, we have L, load, O, optimism, V, vascularization, E, exercise. So a much more comprehensive acronym for injury recovery, looking at more than just compressing, elevating, and applying ice and resting, but specifics with regards to now we have education, now we have optimism, educating people on what to expect after an injury, what typical injury recovery guidelines are like afterwards, giving motivation and encouragement as these sorts of injuries tend to generally heal and get better with active therapy and rehabilitation, in addition to incorporating exercise. So not, the old adage was you get injured, you don't do anything until it gets better. But here we're looking for, okay, if you injure your lower body, are there still some upper body exercise that you can do? Can you still work on the other leg, doing some exercise to try to maintain some of the muscle bulk and the strength on the other side? So there are things that we're looking at incorporating that go beyond just, oh, you got injured, you can't really do anything about it. But how do we try to foster a more comprehensive approach to help with the recovery and the healing, in the hopes that somebody can get back to sport or back to their activities sooner? So the question now becomes, do I use heat or do I use ice after an injury? And also after workouts or activities where maybe you didn't have an injury, but you're feeling some of that soreness. So the premise behind using ice was that we're slowing the inflammatory process, slowing the metabolism, and we're decreasing some of the swelling in that area, in addition to helping with pain control. And it is true that when you're applying ice, you're numbing the skin and slowing down those nociceptors or those quote unquote pain signals from being delivered. However, the difficulty with advocating for ice is that even though you may feel like there's less pain, you are more so just numbing that area, and you're not necessarily decreasing the swelling, you're just preventing future swelling from occurring. However, the question goes behind, why is there swelling initially in the first place? So swelling is a part of our inflammatory process that our bodies undergo when we have any sort of insult or injury, where our body is delivering nutrients and cells and trying to initiate that regeneration process and try to get the ball rolling to help clean up that injury site. So, if there are damages to the cells and the tissues, our body gets into that inflammatory process. And we need to have this inflammation in order to expedite that. So if we apply ice and we slow down the inflammatory process, some may argue that we're actually doing more harm than good because we're preventing what's a naturally occurring bodily process from happening. If you cut your finger or your arm and there's bleeding and your body kind of goes through the process, you apply a band-aid, right? What's happening the moment that cut happens is our body is going through that same process to try to help with the tissue healing, help to form a clot in that area, and helping to form new skin so that area is closed down. We wouldn't want to interfere with that process other than maybe applying a band-aid to prevent any sort of infection. So why are we doing that with ice? When we look at the acronym PEACE and LOVE, the A stands for avoid anti-inflammatories, which further reinforces the belief that maybe applying ice immediately after an injury to halt the inflammatory process might not be in our best interests with regards to recovery. Let's talk a little bit more about heat. I don't want to incorporate heat within the first 1 to 2 days following the injury, and we don't want to increase the swelling and the blood flow to that area because we can increase bleeding. Because if there's an injury there where not only the muscle, the tendon, the ligaments are injured, but also the blood vessels, if we add heat in that area immediately after, then in theory we're increasing the amount of bleeding, and in actuality we're increasing the amount of bleeding happening in that area because we're getting more blood flow to that region. So heat may not be appropriate immediately after an injury, but in between workouts or after a workout, it may be beneficial. And the reason for that is when we apply heat locally to our knees, ankles, whatever region is sore or bothering us a bit, if there's no swelling after the activity, then applying heat to that area can help with blood flow, can help with circulation. It will help to increase the pliability of the tissues, of the tendons, ligaments, the muscle, just to kind of get things going a little bit more. Things will be a little bit more flexible, more fluid. Causes a vasodilation of our blood vessels to get more nutrients, to rid of some of the lactic acid and the metabolites and the hydrogen that builds up when we start to feel sore, DOMS, that delayed onset muscle soreness. So heat in between activities can actually be beneficial if there's no swelling associated with it. The question then revolves around, then what do I do, heat or ice? It really just depends. It depends on a lot of different factors. Some people just prefer to use ice. And I mean, I'm not going to be the one to say you shouldn't use ice if that's what you've been doing your whole life and you prefer to do that or it feels more comfortable. I'm just trying to tell you what some of the research is saying and trying to challenge your beliefs on what we've believed and what we've been taught in school when I was younger for, the last almost 50 years with regards to how to treat a musculoskeletal soft tissue injury. The thing to be mindful of is not only just your preference, but also what are the goals of these modalities? Are we trying to, if pain is predominating and we really feel like there's nothing that can help except ice, then by all means go for it. An alternative to both of those strategies is just to incorporate some form of exercise that is based off of your tolerance and what was actually injured by speaking with a physiotherapist. So there is some research that supports an active recovery following an injury. So for example, if you hurt your ankle or if you roll your ankle, it's going to be bothersome to walk on it, so you can use crutches to help offload and put weight or not put weight at all depending on what you're feeling. But it's also important to look at other alternatives to maintain your health, your cardiorespiratory fitness and health, and continue to move, because obviously we know that we can decondition quite quickly following an injury. So an activity like cycling is a form of active recovery in the sense that we're still moving, but we're not in that weight-bearing position, and the load on our joints isn't as high as it would be if we were walking. And again, it would just depend. Of course, if you had a really bad sprain, you probably don't want to go on the bike right away, but there are things that you can do. Even an arm bike, if you can't tolerate any form of lower extremity conditioning, can help to maintain your fitness and your health. Instead of thinking about it as just heat versus ice, the alternative is just to look at what forms of exercise and activity can I do to help me get back to my activity or my sport as soon as possible. So there you have it. We chatted a little bit about heat versus ice, some of the common misconceptions about ice and the role that it plays in recovery, why it may not be the gold standard or the panacea of healing that we thought it was in the past, because there's not a lot of research to support it, using peace and love as an acronym instead of RICE, and just making you think a little bit more about what to apply the next time when you have an injury, and being mindful of what the pros and cons of each of them are, either after an injury, but also in between workouts and after a workout if you didn't actually have an injury. So let me know what you thought about this video. If you found this information valuable, please consider subscribing and liking this video. And until then, we'll see you in the next video. Thanks for watching.